Hello, it's Katie
And Niamh.
and we're from Kingsland Physio. So we thought we'd start a blog just to give you some information and advice about certain injuries you may have. So today we thought we'd speak to you a little bit about low back pain. So 80% of us will have an episode of low back pain at some point in our life, and the majority of the time there's nothing serious underlying, but it can be limiting and painful. There are certain red flags you do need to look for, which is very rare, but if you look at the link at the bottom of our page, I've written an article about low back pain, and there is a list of things that require urgent medical attention, so it is worth having a look at those just before we go any further. Niamh's going to talk to you a bit about how to manage acute low back pain, so when you maybe do something the day before, wake up the next morning and you're really quite uncomfortable and sore, so I'll let her just talk to you about that just now.
Yeah, cool. So the first thing is to keep mobilising, even if it's uncomfortable to do so. All evidence kind of supports you moving as much as you comfortably can. Next thing is kind of positioning. So people will often tell you that sitting for a long period of time or standing or walking for a long period of time brings on their pain too. So what we kind of advise to do is just to keep changing your positions before you allow that pain to come back on. Last thing then is analgesia. So people sometimes will have difficulty even moving, getting out of a chair, sleeping, things like that. So what we really advise is to go to speak to your GP or pharmacist if that's the case with you, and they'll be able to best advise on what medication might be best for you. Next, what we'll do is we'll go through some exercises that will help you during this acute phase. We're happy for you to experience some degree of discomfort and tightness. However, if it's kind of bringing on sharp pain and it's worsening any of your symptoms, I want you to stop doing the exercise altogether.
Yeah, okay, and we'll come back to you in a bit. So we begin lying on our back with our feet and knees hip width apart, head on one pillow or a folded up towel. And all we're going to do is we're going to roll back like we're about to lift our bottom up, but not quite lift it. And then we're just going to roll back down and arch our back a little bit like we're making a small tunnel underneath. You only move to what you can comfortably. You don't need to force this through any pain, but it might feel like it's stretching something or a little uncomfortable. And if you did about 10 of these and do that a few times a day, it does help start to loosen things off. Starting in the same position, but this time keep your feet and your knees close together. All you're going to do is you're just going to roll your knees to one side until you feel a stretch in the side of the back. And we're going to slowly roll back the other way. And you just go again to where you feel a bit of a stretch, but no sharp pain. And you do that about 10 times, and again about 3 times a day. 4-point kneeling, so our hands are under our shoulders and our knees are under our hips, and you can have your toes tucked or untucked, just whatever's comfortable at this stage. I would say most people prefer untucked. So what we're going to do is we're going to arch and round our back as much as we can and just tuck your head under as well. And then we're just going to arch the other way and just look forwards. And then you just alternate between the two. And you can go as slow as you want and just go as far as you can comfortably. And the same idea, there's no fixed number of repetitions, but if you could do about 10 a few times a day, it helps loosen off the spine a bit.
So it's important to note that not one approach fits all. If you're continuing to struggle with your back pain, it may be best to go see a physio. They can assess your symptoms and then guide your rehab in allowing you return to full function.
I get a lot of patients that ask me about Pilates for low back pain, so I'm actually doing my Pilates teacher training just now, so if you have any questions you can just book in and see me and we will discuss it further. If you have any more questions, please just message us through social media on our Facebook or Instagram page, or you can just give us a phone and book in and see us today. Okay,
Thank you.
See you later, bye.